You're good.
Oh, good.
Come on, Zach.
All right. Awesome. So we're going to be talking about knee injuries and prevention today. And we are starting off with a quote from Alex. Inconsistency in training is the most common reason runners' performance is sabotaged, and the top reason for inconsistency in training is an injury. So, what are the goals of prevention? We want to minimize your risk of injury, keep athletes healthy, improve training consistency, and maximize performance. Oh, sorry.
It must be a Dell, is it? Is it a Dell computer? No, okay.
If you use the
Boom. There you go. Huh.
Maybe
So-
go to the next slide.
No,
Then
it's
go to the
okay.
next slide.
Can you put this?
I hit view. I should have said view.
You?
Yeah, on the left-hand corner, top hand left-hand corner, hit view, and it should say play slideshow.
That's what we were playing the slideshow
Oh, okay.
before, and it just was not working. All right. So we'll start by going over some simple knee anatomy. Some people love it, some people hate it. It was my favorite. It's my favorite class. So, most commonly injured portion of the knee, I would say, is the ACL. It is a ligament that runs from your femur into the tibia, and it's responsible for controlling the forward motion of your tibia on your femur. The posterior cruciate ligament, PCL, is in the back here, and it is responsible for the backwards motion of your tibia on your femur. And then MCL, LCL, you can actually see in this picture. But MCL is responsible for the inner knee stability. It runs from the top knee down, and then LCL is responsible for the outer knee or lateral stability. And then meniscus are cartilage, semicircular cartilage pads that provide stability and support and shock absorption for the knee.
So what do, like when we're running, what major part of the ligaments that we use for running going forward? Do we?
Well, so ligaments are passive structures, so they're
Okay.
not something you can track. It's just providing stability
Okay,
for the joint.
balance.
If there's excessive force on the knee in any direction, whether that's forward, backward, side to side, these ligaments have you covered in every direction.
Could you still tear an ACL while just running straight, or does it have to be lateral movement?
Usually.
Usually it's like a step and twist,
it's-
or
so it's
you
lateral.
get hit
Or you get
from
okay, so it's a
Yeah.
lateral
from an
movement.
angle.
Right, so any angular movement,
Yeah.
but it could happen in running when the person has a tendency for the knee to go inward too much.
To
If
pronate.
they don't have they don't have the strength in the lateral muscles, the knee tends to go in all the time. And remember, when we run, we are on one foot at all times, not two. So then all that pressure, as it keeps on going inward, it may strain the tendon and at one point will pop. It's rare, but it can happen when you have that kind of mechanics.
So that torque of that overpronation, okay. Because you hear so many people like it's like the West Side Story. It's like when people find out like, oh, I run, like, oh, aren't you scared you're going to wear your knees out, you wear your joints out, and to your ACL? I'm like, what are you talking
Yeah, the answer is yes, you wear them out, but you wear them out if you're asymmetrical in your movements. So then you're wearing unevenly all these
Unevenly.
joints. So of course you get to the
That
knee
unbalance.
replacement at 50 because you thought we were just running too much, and we were running in in structures that were not even, so therefore you overused it. So
Go ahead.
So what are some common running injuries? So the highest proportion of running injury occurs from the knee down. And the top 3 anatomical locations for running injuries are patellofemoral pain syndrome, Achilles tendinopathy, and medial tibial stress syndrome, or other known as shin splints. So all 3 of these injuries are common to both genders, but women suffer significantly more knee injuries when compared to men, which I found interesting. But I want to go a little bit more into these 3 different injuries. So back here, so this top right picture is showing us patellofemoral pain syndrome. So if you are excessively, say you're doing like a squat or a lunge and you're excessively going past the knee, that puts a lot more tension on the patellar tendon. Let's see. Then the rest of these are just tears. So how can we control these risk factors? So there are extrinsic things that we can control, like your running shoes. There's education about these structures and how to protect them. There are training techniques that you can incorporate into your warm-up and cool down. And then we need to take a look at individual running mechanics, making sure that your joints are lining up properly and you're not putting excessive force on certain structures or ligaments. So extrinsic first.
So yeah, just a little bit back on those 2 points. One, knees are particularly weaker, and this is known in regular literature about females being more more prone to an injury, many times because there's not enough balance and muscle strength comparing hamstrings to quads. Many times people have very tight quads, pulling the tendon up, causing that friction, the picture right, top right. So it causes that what people call the runner's knee, which is very common. And usually it's because of the quad is too tight, so then it pulls too much on it. If the angle becomes more often in females, the knee goes inward. So what you need to do is work on muscles on the outer side to prevent that. A good analysis will help you figure out by how much and what to do. So it's always good to have a good gait assessment to figure out if that is the problem, because that can also lead to problems at the hip or at the ankle without you wear too much. So that was kind of that.
Isn't
Yep.
it also because women's hips anatomy is different than
Yeah.
men's?
Yes, and that can
Why-
make that tendency.
Yeah.
Yeah. So it's just a matter of exactly finding if someone has more deviation or tendency, and correct that by strengthening the right muscles to keep it straight and work for the child.
Yeah, that Q angle.
Okay.
Oh, you good.
So what's a really easy thing we can control? The kind of shoes that we're wearing. We want them to be weather appropriate and we want them to be surface appropriate, but we want to make sure that it's providing your foot stability and not just cushion. Alex, I know you have a lot of thoughts about
Yeah, but I
shoes.
will hold myself on so much on the shoes. There's a ton of things to talk about when it comes to shoes. They can be tested nowadays, and we can find which shoe gives you the most advantage. And also, not only we can just see if someone pronates, and that usually is the easy, quick sort of advice out of a regular shoe place. But nowadays we have technology that can check stability, strength, flexibility, and so forth. But one quick tip: if you have a problem with pronation, if you have a arch problem, always look for shoes that have stability, and make sure the person who's selling you the sneakers know what stability is, because sometimes they find you shoes that are very bulky, and that does not give you stability. So that only gives you sort of a cushion, but no stability arch. So that would be, but there are many things to know about shoes, which gives you better support or more advantage when you run, and that's easily tested.
So,
Education.
very important factor in preventing knee injuries. So, advice, incorporating proper nutrition and rest into your training schedule is very important. But also, we can help greatly by providing you with as much information on your running form and gait as possible. So, awareness of what's going on in your body and what you can correct and work on. But there's plenty of resources out there, and social media has been a huge, huge help in a lot of people's training plans the past 2 years.
It's crazy because the thing is, I mean, like, for example, we didn't have the internet in the 90s, right? So if you wanted to take up running, like for me, when I started running, I didn't know there was any running specialists, but I also didn't know about physical therapy. And the only way that you would learn about running is going to a library and buying a book on jogging. And then you go into a store, like you go to the mall, every shoe says running.
Yeah.
So you're expecting like, oh, I can run in this shoe. But then you run in it and you would get hurt.
Yeah.
So,
And now we have so many resources, it's amazing.
well, social media can be good or bad, right? So
Yeah.
there's the,
I
if
think
you
it's
rely
wrong.
on Dr. Google, you'll be in big trouble because it's like going to Wall Street and asking what's the best stock. Everyone has a different opinion and they're all right. So filtrate that information with somebody else who has also had experience and is not to use it. In fact, you should use it, but be responsible
Yeah.
with how you're using that information because things that apply to you may not apply to your next door
Yeah.
neighbor kind of thing. So ask Jerry.
Now ask Dr. Allison. Training.
What is it?
Training.
Self-coaching, bad. Don't try to coach yourself. The first thing I tell people, we all think we know. And if you don't have someone else looking at you from far and giving you information, you'll run into a problem. So I have had cases of parents coaching their own kids, not a good thing. Then they have the best intention, but then there are too many dynamics that can
They've got
give it all,
blinders on.
themselves from being able to give them good advice. So always asking someone.
And cutting quarters in your training is going to come and bite you in the ass later on. It's a very common reason for injury is increasing training too quickly.
Right.
And back to social media, there are misconceptions out there, so be careful with what you're listening to and what information you're taking to heart. And there's a lot to be said for your running mechanics. So you want to pay attention to cadence. How many steps per minute? Your stride length, is it symmetrical? Is it significantly larger on one side versus the other? Your vertical displacement, making sure that you're bouncy enough. You want to be up in the air, but you don't want to be wasting too much energy.
Too much floating.
Yes, exactly. There's a fine balance to it. Any anatomical abnormalities that you may have, your joints may not line up the same way any other person's do. And that could lead to predisposition on certain injuries and any asymmetries. So the gait analysis is really, really helpful in getting all that information. And some common corrections that we often give to patients are keeping your elbows back, increasing your cadence, how many steps per minute, promoting position A with a high knee and dorsiflexion with your toes up. Leaning from the ankle, so you don't want to be perfectly straight up, you want to have about 3 degrees leaning, but you want to be leaning from the ankles, not just from at the hips. Your back will not like that. And you want to feel your toes all the way through the push-off, so that you're pushing back and using everything you've got. So for training approach, you want to make sure there's a balance in muscle strength, keeping things flexible, including cross-training, and incorporating necessary amount of rest. Review your mechanics. Proper squatting is huge and not taught often enough. Jumping drills and landing drills.
Look at that guy. You know that person.
I know you said to take out some of the videos, but and these are some exercise ideas for knee strengthening.
So there are some reverse lunges are helpful. We'll call it crab lunge, which is somewhat more of a of a diagonal kind of feel, and then you go back. So you're using all the sides of the range of the muscles. So you want just for training and warming up, because it helps increase the flexibility and lubrication of all the joints that you're going to use. Yes, we try to run straight, but for warming up, it's really important to have all the joints lubricated. and then the other one, you want to use some sort of elastic band to give some resistance, and you want to do the drills with resistance, because what we want to do is elevate that hip when we run and be able to have that end range really strong, because that's what keeps it up in the air, and that gives you more elevation. And elevation means more time in the air, less time on the ground, which is what's more aerodynamic. So training that elevation of the hip is really important. So we want to use the last 15 to 30 degrees under resistance to train that.
Really get that range. Get out that marathon stride. This is
That's a video. That's a really cool video from.
can you play?
Yeah.
Okay. Ooh, that's a good one.
Yeah, her form is great.
Oh, that's the test. That's the test. That's the test.
Jerry got very good at it, by the way.
That's the test.
So you.
Everybody's gonna have to do that before we leave. Everybody's gonna have to do that. That's the test.
And then you're able to then use
Watch.
the energy
Boom.
immediately.
Oh, and you land the opposite side.
So those the files with muscle memory, really cool. What else did she do? That's another exercise that's really great. So you want to try that position A. You want a really quick response from the tendon and back into position A. Watch the arms are always opposite, just like Jerry says, always out opposite the arm. And you want to use that quick reflex to strengthen the tendon, that what's giving you free energy. Also a really great one. What else do you got? Oh,
That
that's
one,
awesome, yeah.
this one, that one's actually pretty hard. That one's hard. Because she makes it look so easy. That ball is not easy to balance yourself. See, she had a little issue right there, man.
Yeah. Now you're using a lot more ankle stability. Ankle is always wobbling, so it's important to strengthen an isometric position in what you do there.
That's good balance.
Yeah.
Again, that's to train that.
Yeah, I gotta do more of that.
Shouldn't the ball the foot?
Yeah, I run ball of the foot.
So, know yourself, know your anatomy, understand the risk factors and how you can control them, understand your gait patterns and what you can work on, get advice, but make sure you're checking where your advice is coming from. WebMD is not your friend. Make sure that you have a solid, well-rounded healthcare team, no self-coaching, include gait analysis if you can, and keep your training consistent.
Yeah.
That's the way to prevent knee injuries.
Questions?
Questions, guys?
Anything about knees?
Yeah, so when you're already starting to have some pain in your knees, that's preventative. Now what do we do when you start to feel the stuff in the front? Like I tend to feel sometimes stuff like right here. Like, if, what do you suggest? Like, is it a matter of stretching it out more, or just staying off of it until it goes away? Or?
So you can guess, but you shouldn't. So first of all, if it's only hurting on one side, chances are there's a problem with that side. And sometimes the problem is not at the knee. It may come from the hip, it may come from the ankle, and you want to find out, because if you start patching, then you start chasing a problem with another one. So very acute pain, you want to ice and rest doesn't mean stop completely running, but you want to, if you want to use the common sense first before you look for advice, you want to make sure if it's a very acute and it happens only when it's running, then you're going to decrease the duration, and maybe you can increase the frequency, but less intensity, and see how that works. The second part, you do want to ice it because that can decrease some of the inflammation if it's happening. And the third thing is you want to then rest enough. Many times we don't rest enough, and that can cause some obviously accumulation of pain. I wouldn't take any anti-inflammatories or anything like that because we want to know where the pain is coming from, and you want to look for a pattern. When does it hurt? If it's a constant pain, you do have to stop and you do have to look for immediate attention, whether it's a therapist or a doctor that it's experienced in running, because not everyone's the same. You go and look for someone who works with their golfers, chances are they'll just say, it looks like this, and they can have a good guess, but you want someone who is sensitive to running. If it is a constant pain, if it's not constant, then you want to find out when is it happening. Is it going up, going down, when it's too fast, or is it my long distance? And is it only when it's running, or is it when I'm walking, or when is it disappear? Because then it starts giving you information that you can pass along if it doesn't get better. And then any swelling, you also want to take a look and see where it comes from. Swelling, if it's right on the knee, there's a lot of tendons, not so many muscles, and tendons are very poor at communicating because they don't have blood, or at least they don't have a lot of blood and not a lot of nerves. So then you will find out 10 days after you had an injury or 5 days after an injury, kind of late. So if you continue the same pattern of running, you may continue aggravating. So that's more or less for the common sense. Then look for someone to analyze your performance and see where it comes from. It's best to find where it comes from and resolve the reason why it started, rather than it hurts here in the street right now. You may be just patching it. Anybody else? Did I miss anything?
All right.
I'm good.
Poor Evan is struggling because, I'm sorry, I was going to say he's not here tonight because he actually has a lot of swelling in his knee.
Yeah.
So he had to go get it looked at the other day, and it's painless swelling. That's another thing. Sometimes I guess there's, there could be swelling but without pain.
Yeah.
And I think it's a collection of fluid.
Yep, exactly. So if the swelling is not from a contractile tissue or muscle, then it could be something called synovial fluid, which is the lubrication that every joint has. So when it's disrupted because of maybe a meniscus tear or something, then that fluid zips out and it pouches out in the air. So you'll see it, but it doesn't bother you because it's not an inflammation. It's just a bunch of fluid that came out of the capsule. Oh, what you got?
I know you showed like body weight and like resistant band type exercises, but are there any like strength, like weighted exercises that I can do? Like I go to the gym, I try to do some of these, but I'm also doing like deadlifts and like squats and some kettlebell swings. So I just want to know if were any of those helping prevent my knee issues.
Absolutely. Yep. There are all kinds of different ways to put resistance to the body that helps you. So not everything is. Bands are helpful, but if you have, that's easier for someone to have at home. But if you have weights, kettlebells, and weights, there are so many exercises that you can do to weight-bearing exercises that are very helpful because that's how we run, putting weight on our joints. So if you find ways to, there are a ton of weighted exercises that are very helpful, especially power production and so forth. They're the next level. And for that, if anyone has a question or doubt or want more ideas on how to properly use weights, you're going to talk to Zach in the back.
Yeah, Zach's really good.
Yeah.
And I would definitely recommend weightlifting, especially if you guys are putting so much tear and wear on your body for doing mileage. You've got to make sure that you're balanced, because when you're using some muscles overusing, those other ones that you don't use, those are the ones that are going to get you unbalanced. And maybe 2 weeks or 3 weeks before a marathon, and then a bug comes up, and you have a little sore spot, and you find out like, oh no, that could have been a stress reaction. If you worked on your balance, doing weights and everything, that's going to help you prevent from getting injured. But also lifting weights does help with bone density too. So it makes your bones stronger. Same as running, helps with bone density, but even weights do even better with bone density.
The other thing that I was going to mention, actually I should have done that last time. You have to have a program. We all have a plan to run the 5K, 10K, the marathon. Have someone give you the loads for that. You can Google as much as you want, but that'll all be a guess. If you have someone like Jerry who would make the plan that is sensitive to yourself. And if you, God forbid, you have a gait analysis, that would be even better, because then he can be more specific at the amount of loads, how much you do, so that you become yourself an expert at analyzing where you're at, but have constant communication with someone who will see you through the program that's going to take you to meet your goals. So having an organized way of training is very important. He will monitor all these imbalances that you may have.
I'll be a concerned parent.
Yeah.
Alright, so guys, we're going to leave in 3 minutes, change clothes, grab water. Tonight on the docket,